guys, I'm Maria Van Sant. I'm a speech and language pathologist. I wanted to discuss today a little bit about how we get our children in speech therapy. I have a lot of parents who come to me and ask, I'm concerned about my child, I don't know what to do, I'm not quite sure what the steps are. So I want to go through a few basic steps of what you need to do in order to get your child in therapy services, or at least tested for therapy services. So number one, most important thing you have to do is you have to sit down with your pediatrician. Because we live in a world that's governed by the insurance companies, we can't do anything without a referral from our doctor. So sit down with your primary care physician for your child, which is going to be his pediatrician, and have them give you a referral for speech therapy. Let them know your concerns, let them know what the issues are that you're seeing and why you would like for them to be tested further. Once you have that referral from the doctor, then you can figure out where you're going to take your child to be tested. Most doctors have a relationship either with a therapy clinic or with a hospital that they're in network with. So when they give you that referral, the referral may already be to a particular location. You don't necessarily have to go to that location, even though that's what it says on the script. Any other therapy clinic can still take that script, even though it's not for them. If not, you can always just have the doctor write you a blank one that just says speech and language evaluation and treatment. Next step you want to take, if you do want to go somewhere else besides where they've given you the script to, is to call your insurance company itself. Find out what your benefits are. Figure out if you can even have therapy throughout your company. And then have them give you a list of providers that are within their network. That saves you the hassle of calling every company and asking them if they take your plan. Get a list of who's in your network and pick a couple of different companies that you would like to go to. So you want your referral from the pediatrician and you want a list of providers from the insurance company. When you're on the phone with the insurance company, go ahead and ask them a couple questions. Figure out if speech and language therapy is even covered in their network. Some of the private companies only cover speech if it's the result of an accident or if it's because of a medical condition, say autism, cerebral palsy, Down syndrome. It has to have a medical diagnosis in order to be covered. So find these things out ahead of time so you don't have any surprises when you're going in and you have to pay a good chunk of money for an evaluation. You've got your referral. You have your list of locations. Now go ahead and call these companies and get an appointment. The reason I tell you to get a couple of different phone numbers is because some companies are swamped and they may put you on a waiting list. So you don't want to wait 2-3 months to have something tested. You just want to have an evaluation to see where your child stands. Call a couple different places. See what their wait times are and then wait accordingly. If you have a waiting list and there's nothing else you can do about it, then go ahead and wait for somebody to call you back. Once your child has been tested, then the therapist can give you an idea of what's going on. They'll look through and figure out where they are age-wise, where they are development-wise, what kind of issues they're having that are just normal for their age and what kind of issues they're having that really need to be worked on in order for them to develop properly. They'll also give you, that's great. They'll also give you a list of treatment times and days, the duration and visit length. So they might want to see your child once a week, twice a week, 3 times a week, depending on how severe their issues are. That's pretty much what you want to do in order to rule out whether or not your child has a problem, whether or not they need treatment, and what you can do to follow it. If they need therapy, then hey, you know what? You already have a clinic, you've had the evaluation, the therapist can work on it there. If they do an evaluation and everything is wonderful and your child's developing accordingly, then you cross that off your list and you know that it's not something you need to be concerned with. So that's pretty much the basics of how to get around having a speech and language evaluation done for your child. I hope that helped. Thank you. Bye.